Thank you, Professor Park. Good afternoon, ladies and gentlemen. I'm Jeon from SNU Bundang Hospital. So it's a great honor to be here, and I'm going to talk about how to use LLM, large language model, in medical research. So actually, my talk is not for the academic detailed stuff, but for practical use in our daily practice. So to be happy. So please enjoy. So first of all, it's AI-empowered literature search. So we get most of our reference from the PubMed, which is a valuable resource of medical knowledge and trusted search tools. There is no doubt that PubMed is highly useful. However, when I search something like APCIS bursts in multivessel coronary artery disease, I got a large number of papers when using the best match option. Instead of the key study, the well-known key study, I often see less important review article or case report. So while PubMed provides a lot of data, it has a limitation as a search tool. So I would like to introduce some new AI-based tool. The first one is Perplexity. The biggest advantage of Perplexity is that it provides accurate reference with link without the issue of hallucination, which is common problem with large language model. It also give a brief review of the question, so PCI versus KFG, clinical outcomes, survival, mortality, and the intervention rate, and something. And then it even search for the current guideline related to the question like PCI versus KFG. And we can check the reference here, and easily go to the reference document. And the next tool is Consensus, which is also AI-based. Its main advantage is that when we ask a question related to a research hypothesis, it sorts and finds relevant reference. For example, if I ask, is PCI better than CABG in multivessel disease, it shows the percentage of study that conclude yes versus no, and provide a summary review of top 10 research papers. And it also finds the cited studies, and we click the study snapshot, show a brief summary of study population, sample size, and method and outcomes. And clicking further allows access to detail of information, the paper, citation numbers, and also abstracts, and directly link to the document. Okay, and the next tool I would like to introduce is Google's Notebook LM. This is excellent for analyzing PDF files. I uploaded the 3 studies related to the mitral clip, co-op and mitral fall, and reshape heart failure. As you know, these studies examine the clinical outcomes of mitral clip for severe MR, but reach different results, leading to a lot of discussion. So Notebook LM effectively summarizes and compares these studies, including the comparison of the results and the study population, and the reason why difference. So its most impressive feature is that it provides an audio discussion summary where it generates a conversation between 2 people discussing these 3 studies. So this is the audio summary. Okay.
Outcomes. You're right. The findings aren't completely straightforward.
Okay.
And that's often the case with medical research.
Sure.
Each study adds a piece to the puzzle.
Right.
And
So even though both studies looked at people with severe mitral regurgitation,
right.
there were subtle differences in the patient populations
So
that
Google
might have
has
influenced the
mentioned that
results.
soon
Yeah,
user
that's
will
a
be
possibility.
able to
Could it be that
participate in this
sicker
discussion
patients, those
as
with
well.
more severe regurgitation,
And-
actually see? All right, so we've got some
Okay.
really interesting.
And next is data analysis using AI tools. The ChatGPT can perform data analysis using Python. Python is one of the most widely used programming language and is specialized for managing and analyzing data. ChatGPT has over 300 built-in Python library, allowing us to upload and analyze our own data. Supported data format include common and used Excel file as well as Word, PDF, and even imaging and video data. We can upload files up to 500 megabytes for analysis. And this feature allowed us to upload the data file and perform the data exploration, making a basic analysis and data exploration remarkably easy, like this. And so I have developed some specialized GPTs for use in data analysis of my research. OpenAI allows users to customize ChatGPT, so I've created a GPT app that can perform the analysis based on the specific logic, and it's available for everyone to use. This GPT is designed to create table 1 baseline characteristics. When you upload your own data file, it automatically identifies the variables and asks which variables to use for grouping. It is set up to perform the following analysis for continuous and categorical variables. So this is an example. You can assess this by searching for Medistat table 1 by Jeon in Exploring GPTs. When you upload your data, it automatically analyzed the variables, continuous variables and categorical variables, and ask you which group to analyze. For example, I want to DM diabetes, so I just say DM, and it then performs the analysis and directly create table 1 like this, and we can check the variables and group and p-values here. And then it also asks which format do you prefer. So if you choose Word file, so just say Word. It provides a download link, so we can download the complete table 1 data in the Word file. This is table 1, and a little bit editing. So this is final result. And okay, similarly, by searching Medistat ROC, you can access a GPT specialized for ROC analysis. Simply upload your data and enter the exploratory and response variable, for example, age for predicting MACE. It will then generate a ROC curve and provide a graph and some statistical value, AUC, and 95% confidence intervals, and p-value, and optimal cutoff value. So in this data set, the optimal cutoff value is 65 years, and sensitivity and specificity is very easy and just a minute. So with ChatGPT, we can create any type of graph and tables you need just by asking for it using your own data. And the next one is manuscript writing using the AI tools. So I know that there's a lot of debate around using GPTs for manuscript writing. So that's why I always say I'm not telling you to write your paper this way. Okay. So the recently released GPT Canvas is very specialized for writing. If you entered if you enter the well-prepared outline of your research and key data and ask it to write on the 4,000 word in English, it complete the manuscript within a second. This is method, result, and discussion, limitation, and conclusion. And then you can review this draft line by line and giving the guidance on any adjustment you want. Just say, so add some sentence and remove something and add some data. Like this. So, and then it can adjust the length of the whole text. If you want longer text, just drag this button so it make longer text. And so, and some editing for format. So, this is the final result. The most important thing is to prepare a well-organized outline that fully reflects your insight on the research and to provide accurate guidance on data interpretation. This is the best way to achieve a good result. So the consensus on this issue is to allow limited use with the requirement for transparent disclosure and an emphasis on also responsibility. The most progressive journal on this issue is NEJM AI. This is the only family journal of NEJM, which published an editorial titled "Why We Support and Encourage the Use of LLM in NEJM AI Submission." In this paper, they said LLM can produce better scientific outcomes and help non-English native speakers and reduce the language barrier, so improve the quality of scientific literature. And it can make the science become more globalized, and insights are produced by a diverse range of researchers. And the most important thing is this: we cannot ban on use of the LLM, so it is likely not enforceable. So the better tool that we provide to scientists, the greater their ability to do so. So I totally agree with this opinion. So my opinion is this. This is a sentence from Korean novel, my favorite writer. The science cannot go backward. It just arrived where it's supposed to arrive. So we have to adapt to a new paradigm, and we have to educate them well and use safely and right. So thank you for attention. And if you need for more information, please check out my YouTube channel. Thank you.